Hello everyone, I'm Dr. Cemalay. I'm an ophthalmologist, a European board certified and international board certified ophthalmologist since 2014. Today I'm gonna tell you about laser vision correction and some premium intraocular lenses. So let's start with the procedure of laser vision correction. Actually, there are several techniques for correcting some kind of refractive errors like myopia, hypermetropia, or astigmatism. Actually, in the concept of laser vision correction, we plan to reshape the cornea. What is the cornea? Cornea is just the frontalmost part of the eye. So with the help of excimer lasers or femtosecond lasers, we are planning to reshape the cornea. So, of course, there are some comprehensive examinations and detailed diagnostic tests in order to verify that whether if the one who wants to undergo this kind of surgery is eligible or not. So, it is always wise to undergo a detailed examination by an experienced surgeon or experienced ophthalmologist. So after the age of 18, if the progression of the refractive error is stopped, I mean the refraction is stable, then some kind of evaluation can be performed in order to find out whether it is okay to perform a laser vision correction. So depending on the structure of the eye and of course the amount of the refractive error, we choose the appropriate technique for the laser vision correction. There are some surface ablations or some lamellar surgeries or some lenticle surgeries. So we perform some comprehensive examinations as we mentioned before. It is like measuring the visual acuity and examining the anterior and the posterior parts of the eye, and also along with the corneal topography, we decide which technique is the best for the person who wants to undergo some kind of laser vision correction. So in this context, we can perform either PRK, we can perform LASIK, or we can perform SMILE surgeries. Of course, there are some limitations in the context of laser vision correction. So we almost check everything related to the eye. First of all, we just check the vision correction and also the refractive errors. There are some limitations, of course. So if we plan to do some laser surgery to a person, we must be sure that the refractive error should be in the limits. Up to 8 degrees of myopia, 6 degrees of astigmatism, and the 4 degrees of diopters of hypermetropia can be corrected with the laser vision correction. But if the refractive error exceeds those kind of refractive measurements, then we have other treatment options like ICL. It is the phakic intraocular lenses. So it depends on the person's examination results. The most frequent question we come across is that, is there any risk for that surgery? Of course there is risk, but by the help of the detailed examination and those comprehensive tests, we just minimize those risks. Most of those procedures are really comfortable, and almost none of our patients feel any kind of pain or disturbance throughout the surgery. It almost takes about 15 or 20 minutes to complete those kind of surgeries, and most of the people who undergoes those kind of surgeries will return their normal life in a couple of days. But there are some other situations which can affect the healing process. After the surgery, for about 2 to 3 weeks, our patients should use some drops, some antibiotics, some steroids, and some artificial tears in order to improve the healing process. And also, after the laser surgeries, we want our patients to pay attention to some certain situations. For example, for about a week or two, we want them to stay away from the crowded places like sauna or swimming pools. And also, it would be a wise act to protect themselves from some traumas. And it is very important to obtain some good results. But the most important part is just to consult your physician in order to find out which technique or which treatment method is the best for you.
Let's talk a little bit
a very
about
healthy
premium
life.
intraocular lens surgery. Actually, in this context, we recommend this kind of surgeries for the people who are above 45 and who wants a spectacle-free life. So, in premium intraocular surgery, and from now on I will call it as IOL, in this premium IOL surgeries, actually we replace the original lens with the artificial lens. So actually it is kind of a cataract surgery without developing any cataracts. So let's see the lens position. Actually, our lens is just positioned behind the iris, the colored part of our eyes. So as you can see from the model, the lens is just inside the eye. So we just perform some small incisions through some certain positions, and we can reach to the lens. And in this kind of operation, we just replace this lens with an artificial lens. So there are lots of intraocular lenses in the context of premium intraocular lenses, which we can call as trifocal lenses, enhanced depth of focus, EDOF lenses, monofocals, monofocal plus, and some toric versions of those lenses. So there are lots of intraocular lenses. So it is way too important to decide which lens is just the best lens for you. This is actually the most frequent asked question. Which is the best lens? Everyone wants the best lens, but actually there is no best lens. We aim to choose the most appropriate lens for the eye of the patient. It is crucial because we have to keep in mind that there is no perfect intraocular lens. Every lens has some pros and cons. So it is crucial to discuss those subjects with the patient before the surgery, because sometimes people come to us with really motivated energy to perform those kind of surgeries, but also we have to perform some comprehensive and detailed examination before the surgery, starting with the visual acuity measurements. Also, in order to perform those kind of surgeries, people should not have actually any kinds of ophthalmic diseases related to the eye. For example, if someone has some diabetic retinopathy or glaucoma, it won't be so wise to choose those kind of lenses. So it can be performed either you have cataract or not. After the age of 45, if someone wants a spectacle-free life, and also if technical features are okay for this operation, then the patient will be eligible for this surgery. After that surgery, which takes about 15 to 20 minutes, and also a painless surgery mostly, people should use some antibiotic drops and steroid drops in order to improve the healing process. And also after the surgery, we should perform some checkups. On the first day of the surgery, this is our first, that will be our first control. And also after 1 week and after 1 month, we recommend some checkups too. So in order to maintain the stabilization of the vision, sometimes we may need some time. It depends on the structure of the eye, and sometimes it depends on the personality of our patient. Sometimes we should be a little bit patient in order to see the final results. Actually, some intraocular lenses have some rings on them, and some do not have. So there are some advantages and disadvantages related to those kind of lenses. It would be really wise to discuss them to the patient in order to find the most appropriate, the best option for our patients. And also, before undergoing this kind of surgery, people really should discuss the advantages and the disadvantages. For example, the profession of our patient can be a factor in terms of choosing the right lens. Let's talk about the trifocals. Trifocal lenses actually provides the most spectacle-free life independency. Because if the eye is okay for the surgery, and if we choose to implant those kind of lenses, most of the people get rid of the glasses both at the distance or intermediate distance or the near vision. And also maybe some kind of disadvantages for those lenses. Most of the people can experience some photic phenomena like halos, glares, or starburst. Those kind of symptoms can occur especially at the low light conditions, for example, driving at night. So if a patient is a driver, maybe it would be a wise choice not to choose those kind of trifocals. Maybe in that condition, EDOF lenses would be a better option. So as in this example, it is very important to discuss all the aspects, all the expectations of the patients, all the features of the eye, all the conditions of the eye. These are very important factors in terms of choosing the right lens. And also, all the pros and cons should be discussed carefully and in detail with the patient. And also, we should use some drops, as we mentioned before. It is for about 2 or 3 weeks. After 2 or 3 weeks, we just cease the drops and stop them. And also in this period, we just request our patient to pay attention to the hygiene and the healing process of the eye. So we just recommend to stay away from crowded places like saunas or swimming pools. And also it should be really good to avoid some extreme sports after those kind of surgeries. I wish you a very healthy life. Thank you.